let's see, go to the next question. Mode dialogues using Chairwork typically involves physical movement. How can therapists adapt it to small online spaces?
Yeah. Well, yeah, there are many, actually, there are quite many ways to do it if you're not too strict. So it really actually depends on the availability of chairs and space in the client's room, right? So if there's enough room, the therapist can just encourage the client to use multiple chairs, just bring in, and we can either model it by arranging it on our side to just demonstrate how to do it, or just, giving very clear, easy directions in a soft and supporting voice. In case the space is small or there are not enough chairs, we can use cushions. We can use different spots on a sofa or a bed. Okay, so for example, just moving from the right to the left and then to the middle. Standing up, which Eckhart do a lot, I think, right? Like standing up for the healthy adult. And even, just slight changes in the sitting positions like this. Okay, so you can move your chair like this and talk to you in this chair or in this space. And then, okay, now change again. And now be this part that is receiving all these messages that you were, vocalizing from the other mode. We can also use, we can represent mode with objects, right? Like toys, or I love this, this
Mamushkas.
babushkas. Yes, they're really great. If I don't have anything in, near me, I can just use just objects to show something. For example, like how the coping mode actually hide the vulnerable child inside. So any object, it can actually also be combined with homework. Just find objects in your place that would represent your, I don't know, your critic part or your vulnerable child part. You can use mode cards. Like it's not amazing for online because people don't really see it so well with the cards, but sometimes I use it. And also, like, part of the fun is searching the cards for themselves. So it's a little bit, but what I would usually do, like one of my clients, she got this homework, get an object that would represent your inner critic. And she went out to her little garden and she picked up a really heavy stone. And she said, I put it in my bag and I carry it with me everywhere. And when I want to come lighter, I take it out of my bag and I keep it in my car and said, okay, now you're going in without your inner critic, you feel lighter. So it was really brilliant. I think it really works. Representations really work great when the client pick them up. One last thing I may say, not about the arranging, but maybe some tips about how to make a clear differentiation, to make sure that the client understand, for example, that you're talking to the inner critic over there and not to you, right? Then we want to make sure, I would say, so Patricia, I want to say something to this inner critic, right? That was there. Is it that side of you? The chair is over there or over there, because it might change through the internet. So is it there? Does it make sense? Great. Okay, great. So I'm here with you. You see my hand. I'm here with you. I'm near you. And I just want you to listen to what I'm saying to this part. Okay. So I make a very clear understanding that the client understands who I'm talking to. Or I might do it within my room. So I would say, so let's just imagine, okay, that I'm taking this critic of yours and I put it here. So you'll feel safe with me. Okay, I'm here, I'm with you, and I'm just going to talk to this inner critic. It's here now. And I'm going to talk to it as if it's in my room. Okay. And at the end of this intervention, I can ask you if it's in your room or it's in my room to just take out the unwanted mode, right? So we can just take it out of the room, just as we would do in face-to-face, in-person session.
Yeah.
Yeah.
Great, very thorough answer. And yes, I would like to say that I totally relate and I agree with what you're saying. And I again, you're making me think about examples. So in my experience, it is difficult for the therapist actually to have the patient who doesn't understand or doesn't look to the right or to the left and face the critic. So I have to model that. And gentle guidance, is good because this happens through the exercise, and the patient goes back to speaking in a first person. And I feel, I think, that I did wrong, I made a mistake, etc., etc. So I think it's great. And I remember in a Congress, in several Congress, like where Remco teaches us, right, how to wave, and
Yes.
make
Yep.
the voices distinct, which is very important. Scott Caleb always, reminds us of that, right? So I think it's great. I know we trained with everybody. I mean, all the top guys, and women in the schema therapy world. So Bernstein's eye modes, yeah, I think they can be good if the patient, especially if the patient has bought them. It sounds like I'm doing advertising for them, eye modes, but I think they are great.
Absolutely.
Yeah, and images of pictures, and finger puppets, representing the critics, and throwing the finger puppets and doing.
That's amazing. Yeah.
Amazing, right? So we are using that in John Farrell and Ada Shaw's the self-practice, self-reflection, and that's great. And the images.
Really great.
Yeah. I'm sorry?
Oh, but yeah, I was thinking, yes, this is really great. And also something I've done recently is using ChatGPT on a shared screen with my client to put in the description of a certain mode. Okay, so in this case, it was kind of a coping mode that was alerting her from making mistakes or gaining weight or eating too much or talking too much or whatever. And we described it to the ChatGPT. I was doing the writing on my screen in a shared screen. And then I asked, so it came up with an ID of the mode, and then I asked it to create an image, and then I sent it to her. And the following time we worked with this mode, we put it on the shared screen. Okay, so now you can be that mode, you remember. And so it's also quite helpful for mode dialogues and mode works. Yep.
Yeah, thank you. Yes, thank you. I will practice. I have never done that, but sounds great.
It's you'll be so surprised. It's really such an amazing tool.
Right. So that's great. One of the things I do is I have them, and of course, this is not my creation. This is based on my training with John Farrell. I have them write down, the critics, the messages, and then I have them do like this.
Yes.
So, and then, like a little thing, a little ball, and
yeah. Yes.
and it feels
Amazing.
great because it's movement, right? It's really nice. Okay, great. Yeah, so okay. And standing up, that I like that as well, to strengthen the healthy adult mode and observe, that would be more contextual approach, right? That our president also
Right, the
Feldman, uses so much, and so I think that's wonderful. Okay, so let's go to